In today's video, we are talking about keeping your own medical records and why this is important. If we're encouraging you to go get second opinions, third opinions, you want to make sure to have all this information ready at your fingertips. So today I'm going to talk to Dr. Mark Scholes. He's a 30-year medical oncologist who focuses solely on prostate cancer, and we're going to talk about his experience with patients and their medical records. So in today's video, Dr. Scholes, we're talking about medical records. Now, I think a lot of patients kind of think, well, doctors keep my medical records for me. It's in all these large systems like Epic, and we see these big universities use these systems where everything's already in there. So what's really the point of me keeping my medical records? But it's interesting because a lot of times patients don't even know their own numbers in their own case. And as we're teaching them to advocate for themselves, those records become increasingly more important. So can you just, kind of point out some of the most important factors in keeping your medical records?
An important topic indeed. The experience that I have taking care of patients, aspiring hopefully for good quality care for people, has taught me that a big part of the process towards good outcomes is accurate information. And yes, you would think in this electronic age that everything gets transferred very easily and accurately, but oftentimes systems aren't talking to each other. People in different hospital systems keep records in a different way, and keeping all this information organized in an easily accessible way is not actually that easy to accomplish. The patients that try and streamline this process for their physicians, I think, get better care. Ideally, yes, the medical records will always be there, complete, well-organized, and understandable in the system. If you're staying just within one hospital system all the time, that is more likely to be the case. I personally, in trying to find good outcomes for patients, don't refer to hospital systems. I refer to physicians within systems, or perhaps even working independently of systems. Quality is such an important component of good outcomes for patients. That means transferring records across from one system to another, and they will come in unfamiliar forms and be organized differently. It's not uncommon for them to be incomplete and for doctors to be confronted with decision-making process with not all the information at hand. There's a real place for patients themselves to start to take responsibility for gathering this information, and in some cases even organizing it in a presentable form.
So yeah, it's quite interesting because you would think, well, you go to these large universities and they kind of have everything in one place. And then, as you said, you're transferring to different physicians. And I don't think people realize when you're going to centers of excellence and you're wanting to seek the absolute best care, the physician you're going to matters so much. How many procedures have they done? And what, we've talked about the centers of excellence and the quality of care that patients need to seek. And medical records are kind of something that I don't think a lot of patients realize they need to keep. Do you have a suggestion on how they keep it? Is it in a giant Word document? What have you seen some patient walk in that's just had this really awesome best practice?
First, I think it's good for people to understand the broad categories of records that are being kept. Biopsy type information, genetic type information, scan type information, laboratory type information, and then physician communications, summary statements, progress notes, consultations. Breaking it down into those categories is fairly universal in different record systems. The real issue is asking physicians for copies of this information after each visit that the patient has with a doctor, so that the patient has it accessible and then can copy it and then provide it to the next physician that they'll be seeing. Prostate cancer treatment is often a team of doctors, maybe not all under one roof, but working in coordination with each other. And yes, you can ask your doctor to send copies to another doctor, or a doctor can request copies from another office. But that process can be very crotchety, and records transfer may be delayed, it may be partial. Working through an office, in other words, a patient talking to an office saying send records to another office, is far more daunting than simply asking for copies of the records and then having them on hand to provide to the next physician that you see.
I just wanted to remind you, click that subscribe button. When you do this, it helps support our channel and gets our videos out to other people who need them. Also, if you would like to donate financially, you can do so at pcri.org/donate. And this September, we're having an in-person prostate cancer patients and caregivers conference. It's a great way to get your questions answered in person, and you can learn more at pcri.org. Now back to my conversation with Dr. Schultz. Yeah, it can be quite daunting to ask your doctor or the nurses, hey, can I get a copy of this after the visit? I've been in my own doctor's appointments and they're kind of ready to walk out the door, and sometimes you're just chasing after the scribe going, hey, can I get a copy of that, please? But it is tremendously helpful. I think, I've seen patients keep them in big Google, documents or Google files that it's on a cloud system and they can send it out. But one of the things, even going back to one of the categories you talked about with scans, it's not just the images that you need on a disc that you're getting. It's also the report. And a lot of times they're given some sort of report based off the scans, but they're not actually given the disc itself. Do you have this happen often with patients?
We don't routinely ask patients to provide the actual images, though the over-reading of images is a common request on our part. We'll certainly want to see the reports. That's the images that are interpreted by a specialist called a radiologist, who only looks at images all day long and then generates a concise, accurate description of what's in that image file. But sometimes concerns about the skill level of the doctors interpreting the images comes up, and a second opinion about whether or not the read of the images is accurate can be an issue that's important for patients. And yes, we will ask patients to obtain a copy of their images from the facility that did the scan, forward them to our office, and then we would forward those on to referring centers to do an overread. The whole process, again, often involves the patient himself obtaining the information from the office where he had undergone those scans. I think it can be a little intimidating for patients sometimes to be requesting this type of information. It is something I believe that it's important to overcome, because the idea that the patient is the customer and is the one who is controlling the process, I think is a growing idea in the medical realm for trying to get good quality outcomes.
The idea of understanding your medical records can be intimidating. I think the idea of even using a digital format, and unfortunately a lot of these charts that these large universities use, it's all digital. And a lot of times it's even hard for a young person like myself to go, wait, where's the progress note versus the scan versus the report, And so I think one of the things you've pointed out in the past is that, just having the report in paper and in a file, making a copy of it yourself and then bringing it to your doctor's office and giving them the original. Is this something that you see as most common practice and you see works well for your age demographic?
There's sort of two levels to this whole medical record situation. Talk about understanding it and maybe breaking the medical records down into different categories. And the take-home message for our meeting today is to emphasize that just having the records, not even necessarily in an organized form, but just having them. The physician that you hand the records to, if you have a stack of medical records that you've compiled through previous visits and it has all this stuff jumbled together, can be rapidly reviewed and organized by the doctor that you're handing the records to. But just the fact that the records can be provided to the physician is a big jump forward, rather than discovering that records are incomplete and that now we're going to have to set up another visit while we wait around for a request from some outside office for new records to come in. Doctors are skilled actually at sifting through that information quickly and finding the necessary documents if the document is present. Whether people learn how to organize their records into a more useful format, which is nice, or simply just keep a pile of records from all their different encounters with their doctors and have that at least accessible, because obtaining these records in a timely fashion isn't always the easiest thing to do.
So one of the things we've talked about quite heavily on this channel is secondary readings on MRIs, which we've already discussed, but also secondary, readings on pathology and making sure that the Gleason score is correct. One of the questions I've seen in the comments section as we've talked about keeping your medical records is, wait, do I have to hold on to my own biopsy slide, or is it the report, or is there a disc? So how does that work?
Where do you feel that your information will be safest? The hospital that is supervising the biopsy and having these pathology reports read out by pathologists. They're legally responsible to keep these biopsy specimens safe for 8 to 10 years after the biopsy. That's a safe place. If you feel like you're more responsible than the hospital system and you've obtained a copy of the glass slides from your biopsy for referral to an outside facility, and maybe they've sent them back to you, and you feel like you have a safe place to keep it, that's fine. The security issue is probably the main issue. If they're lost, then that information can never be retrieved. This has come up in issues where people want to do modern genetic testing on these biopsy specimens that may be 5 or 10 years old. In my experience, the hospitals have been very good about keeping these old biopsy specimens safe, and it's very rare for us to put a query out for review of these things, even many years later, and not be able to get good results. So probably safest to send them back to the hospital where the biopsy was done.
One thing about prostate cancer is, we call it a chronic disease in the sense that a lot of prostate cancer is just over this long period of time. Thank God it is slow growing, especially compared to other cancers. But because of that, you need this sense of continuity, and you want to make sure that the information that you're receiving, that the doctors you're working with are also receiving that information. And, you have so many people involved in these processes, especially when you're seeing multiple physicians. If you go get 4 different opinions, you have that entire medical team, the scribes, the nurses, the MAs, the phlebotomists, whoever's taking, that sample, whoever's taking that scan. There's just so many different factors that the one solid person in the middle is you. And you really have to be your own quarterback. We talk about different analogies, but you really have to be that person to say, all this information is going to come to me, and I'm going to be in charge of making sure it gets dispersed properly. In shadowing you in my prostate cancer training in your practice, I've noticed that every patient, no matter how long you've known that patient, you ask them at every appointment, what medications are you on? Because you don't know what their cardiologist or whatever who may have put them on a different medication, and what's the dosage. And even dosage kind of can go by the wayside sometimes, and patients don't always understand the names of their medication, and rightfully so. We have these extremely complicated medications nowadays, and these names that we all have to remember. But I think having a medication list is very helpful, because you can understand, okay, here's my dosage, here's what they put me on, here's how long they're saying to put me on, and communicating that at every doctor's appointment. And I think, keeping your own records and making sure that if you did get a recent MRI or a different scan or something, is the latest PSA, is the latest scan in the system, does the doctor have that? And keeping the dates of those scans and when you had them is critical, because you can go to an appointment and 2 weeks later, maybe that a scan didn't get, transmitted to the doctor, and they're working off of old information. They tell you some maybe very off news. You're sitting here completely emotionally impacted by this news and going, wait a minute, you don't even work off the, new information because you don't even have it. So I think patients really have to advocate for the timing. They have to advocate for, understanding what they're taking when and how, especially if they have any sort of comorbidities or any other issues health-wise. And it becomes a critical point where if patients don't have all that information, doctors really can't give them the best of care. So what's the point of going to a center of excellence if you're not really getting the best of care in the first place? Because the doctors are going to work with whatever information they have. And unfortunately, you're also, kind of in a crunch time where sometimes you only have 15 minutes with that doctor. And so it's important to communicate not just with the doctor, but with the nurses, and call ahead of time and make sure that they have this information so that you can get the quality care that you need, especially since you're going through so much getting all these scans and all these, pathology and all this blood done. You want to make sure that you're ready to go for those appointments. As I've worked in PCRI, I've seen so many patients keep their own medical records, tracking their PSA, and I've seen this just be tremendously helpful, not only to their medical team, but to themselves, so that they have a bigger picture of what's going on in their own particular prostate cancer case. It's also helpful if you come to conferences like ours, or, you're going to support group meetings, that you have your medical records with you, because it helps when you're educating yourself through those conversations, or you're asking a doctor or a support group leader or another prostate cancer patient, and they ask you, what's your Gleason score? What's your latest PSA? What was a side effect of this? It just helps you, keep track of everything. One of the things that I've seen be tremendously helpful is some patients just keep it in a folder. They print everything and keep it in a physical folder. Other patients do it in a digital folder. Well, they'll maybe keep a file on their desktop or on a cloud system like Google or something like that. And, it's really great that you can just access those from a digital place when you maybe don't have the file with you at home and you get into a conversation with somebody. But even keeping your medical records is a a great way to educate yourself because you just have an awareness of what's going on with you. We find oftentimes that patients who are newly diagnosed with prostate cancer are told all these numbers, they don't understand what's going on, and then they're told a number, and then they're asked later, well, what's your Gleason score? What's your PSA number? And they can't really tell you because they don't have their records with them, and they have to call the doctor and log into a portal or something like that. But again, it's just really great to have those readily available. And as we've talked about, your medical team is working very quickly. They're wanting to help you as best they can, and we want to make sure that they have all the information when they're talking to you to put everything into context. Now, speaking of context, something that can help with that is our prostate cancer helpline. These are patients who have been through this whole process. They've kept their own medical records, and they can help guide you through that process. And you can reach them at pcri.org/helpline. If you have further questions about prostate cancer or even the topic of this video, you can go ahead and leave them in the comment section below, and we create more content off of those different questions and queries and ideas that we get. Please remember that you're not alone and that you can reach us anytime at pcri.org, and I hope